Hi, I'm Millie Bierman. This unit in the Helen Bader Foundation CBRF Caregiver Training Program will cover normal aging versus dementia. As a caregiver in a CBRF working with the elderly and those with dementia, it is important for you to know what normal aging is, what dementia is, and what conditions related to aging are. This unit is divided into 3 parts or sections. Part number 1 is normal aging, part number 2 is dementia, and part number 3 will cover conditions related to aging. Each section will begin with a pretest. It will be followed by an explanation of normal aging, dementia, or conditions related to aging. A post-test will follow that section. The pretest and the post-test are the same. Your answers will not be graded. The information in the pre and the post-test are pertinent to that section. There will also be a matching quiz or activity in conclusion of the section. Part 1, Normal Aging, will be narrated and discussed by myself, Millie Bierman, and Jan Navin, a nursing instructor at WCTC. You may now turn off the videotape and complete the pretest. Thank you. We'll see you in a few minutes. Hi, Jan.
Hi, Millie.
Good to see you.
Very good. I'm very glad to be here.
Now we'll discuss part 1, normal aging.
Okay.
What is old? How do we age? What happens to our mental and physical abilities as we get old? Everyone asks the question about themselves one time or another. What happens to them? As a caregiver, people should think, how do I feel about being old? We go through the aging process throughout our lifetime. By age 25, we will start to notice some changes. They're very gradual, so they won't be real noticeable at first. The changes that occur are changes that happen to all people of all races. Aging can take place at different rates and can be influenced by many things. Jan, could you tell us some of the things that aging is influenced by?
I think the main concept of aging that we need to think about and to remember is that the aging body does just fine unless it's stressed. And stress can be a variety of things to a variety of people. The stress that is perceived by that aging body is very individual. It might be by the friends or loss of friends. It might be the living environment. It might be disease or injury. It might be something as simple as, did my daughter water my African violets, or did the cat run away? Other pieces that will impact aging would be the job, the kind of job you have, the kind of stress that's applied from a job, activities, whether the stimulation is there to keep the mind and the body active. There's research that points to the fact that card players, particularly bridge players, maintain their mental alertness longer. What we have inherited from our family, of course, does, I mean genetically, I don't mean financially, does impact how we are going to age. If your grandparents lived to be 110, you probably will be long-lived. If they died at 50, there well could be some genetic piece in your heritage that would influence how you would age.
Mm-hmm. Well, aging does not start at a certain time for everybody. It depends upon, well, for instance, nutrition, good nutrition, exercise, good medical attention, and a healthy lifestyle are real important to prevent aging to occur as quickly. Usually people that have a healthy lifestyle are more apt to be happy, be positive, be independent. Let's talk about what happens to our bodies as we grow old. I think, you know, that we all have to think about that. It's something that's going to happen to all of us. It's very gradual, as we said before, but it's going to happen to all of us. There are many things that we notice as we grow old, but Jan, is there something that's outstanding in your mind that you will notice in the process of aging?
I think one of the first things we see when we notice an aging person or someone who's older is their skin and their hair. Skin becomes dry and wrinkled. Hair becomes gray or white or gets very thin. We react to this kind of a sign of aging. The older person also reacts to the same things. I've had elderly people in nursing homes say to me, "I don't know how you can take care of me, my skin is so ugly." Often the color of the skin will change. We call them age spots for years, and they're the brown pigments on arms and legs. The skin becomes very fragile. It loses the lower fat pad that keeps our skin firm and taut and soft in younger years, so that the skin is almost looks as though you can see through it. It's almost a transparent kind of thing. Very fragile, bruises and tears very easily. It loses its smoothness and it becomes saggy. There are wrinkles and it actually becomes saggy and needs special care because of the normal physical conditional happenings as we age. You also lose the ability to perspire, which means that the skin is unable to do its most protective process, and that is to help regulate the temperature of the body.
So in caring and maintaining for the elderly resident, it's important to evaluate the number of times a bath is given. Once or twice a week is probably enough. And then to lotion the arms and the legs so that the elasticity remains. And pat dry rather than rubbing because of that thin skin. Also, it's important to watch temperatures. When someone gets into a bathtub, they put their toe in, it's real hot. They might not have that sensation anymore that they did when they were younger. So be real careful about the temperature of water and do not use heating pads. That's really a no-no. Also, keep the environment free of clutter. That is so important so that someone doesn't bump into it and tear their skin. So as you get to know each resident, you will come to know what is normal and not normal for them. Changes of the skin that must be reported to the person in charge of the CBRF are excessively dry, flaky areas, itching or rashes, changes in mold, skin tabs, or aging spots, excessive bruising, denting or pitting of the skin, redness, swelling, discoloration, drainage, or open areas. Jan, you mentioned gray hair. What do you notice about aging as far as the gray hair is concerned?
With the gray hair, the hair becomes very coarse. It's more difficult to care for sometimes, or it's different to care for than it was when you were younger, as far as keeping a style or keeping some order to it, so that grooming becomes different. That has to change. It also will thin or get white. In aging, people will lose hair generally over the body, except for hair that will thicken in the ears and the nose, and women often have an increase in facial hair, which can be disturbing to them, needs to be taken care of if it becomes a problem for the resident.
And what is there about taking care of that hair that's different than some other kinds of care?
Well, the facial hair needs to be, you mean the hair?
Well, you know, usually you need to get permission for that.
Yes, yes. You need to have, if the resident can't give you permission to do that, then a family member would have to do that. Because we can't take care of elderly people, particularly in a home. They move to CBRF because they can't live by themselves any longer, but they still have rights and they still have choices. Therefore, we can't just do for them what I feel might be better for them. We must consider their wishes and their needs in that same process.
Yeah, that's right. And with the hair, it's important to shampoo it perhaps only once a week or less, but keep it clean. And for the person or the resident's self-esteem, keep the hair well groomed. I mean, I think that's very important.
I also think it's important that their grooming, particularly of the hair, be appropriate for their lifestyle and the way they would like to look. it's tempting sometimes if someone has pretty hair to put it in a braid and stick a bright bow on it, and if that isn't the style of that resident, that really shouldn't be done.
As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the hair that must be reported to the person in charge at the CBRF are excessive hair loss and excessively dry, flaky scalp. The next thing we'll talk about are the fingernails and the toenails. The fingernails and the toenails, you usually noticed they'll get thick in some cases, become very brittle and break very easily, and there'll be ridging in them. And sometimes you'll even notice discoloration. Jan, in your work, what do you find is important in caring for the nails of the elderly?
The elderly have nails that are difficult to care for. As we spoke about the drying of the skin, the nails are also going to dry, and therefore trimming them and keeping them trimmed allows you to care for them more efficiently and safely than if you let them get too long, because then you might have some tearing and pulling even though you are clipping them. They need to be clipped and filed to prevent injury so you don't have any sharp edges. You want to make sure that their toenails are taken care of. If you don't feel that you're capable to take care of them, or if something about it makes you uncomfortable, you need to ask that a podiatrist see them so that their feet can have professional care. Another aspect of foot care, besides caring for the nails, is to make sure their shoes fit and that the shoes don't have any sharp edges in them, and that their socks fit, their socks or stockings fit. That's as important as having their shoes fit.
So really it's important to almost check the people's feet daily.
Someone should look at their feet every day to make sure there is no redness. We'll talk later on about the lack of pain, the lack of pain sensation in the feet. But this is a good time to make that point, that someone should inspect their feet on a daily basis. And if the resident can't do that, then someone should do it for them.
As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the finger and toenails that must be reported to the person in charge at the CBRF are finger or toenails that are too long or short, finger or toenails that are splitting, jagged or ripped, color changes, texture changes, reddening, swelling or drainage, and crustiness. Bones and muscles, that's the system we'll talk about next. Bones and muscles are the support system of the body. Changes of the bones and muscles are, well, a person might break their bones more readily because they're more brittle. Actually, you will notice a change in perhaps strength because of the muscles becoming a little bit weaker. Not that there isn't still a good amount of strength in normal aging, but it might get that the person would be moving slower. A person can look stooped. Actually, elderly decrease in size about 1 to 2 inches. Shoulders narrow, abdomen protrudes, the buttocks broaden, and the knees bend a little bit so that they can keep their balance. And also you're going to notice people hold their head back for balance purposes. There's flabbiness of the upper arms and legs. In caring for and maintaining the aging residents' bones and muscles, what are some of the things that should be done, Jan?
One of the most important things that needs to be done is regular exercise. Now, this doesn't mean weightlifting and sit-ups and push-ups. It means regular walking, regular activity. With the aging body, muscle mass is normally lost. So some kind of gentle exercise should be done to maintain that muscle mass. Many times exercises can be done with the client sitting in the chair so they can exercise their upper body. Walking is probably enough for their lower body. They need to wear shoes that are safe. A tie shoe is a better shoe than a slipper or a moccasin or a sandal that the heel could slip off of. They need to have independence. It's important to keep them moving, to keep them walking, and to keep them as independent in their activities of daily living. And by that I mean performing the activities that we have done always in our lives, taking care of myself as much as I can, my own grooming, my own eating by myself, toileting, dressing, deciding whether I'll take a short walk to the porch, that sort of thing. It's important that I have that freedom and I maintain my independence in those activities of daily living to keep my mind sharp, but also that kind of activity will help maintain my bone and muscle strength.
Mm-hmm. And sometimes a person will give up if they are rushed, for instance, and they can't do it themselves.
Oh, sure. Sure.
As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the bones and muscles that must be reported to the person in charge of the CBRF are excessive stiffness, change in ability to move, unsteady gait, that's the manner in which residents walk, complaints of pain, excessive bruising, and try to know where the bruises come from, redness or swelling. The next system is the circulatory system. The heart is the organ that pumps the blood through the body. The circulating blood provides food and oxygen and liquids to the rest of the body. The blood circulates through arteries and veins connected to the heart, and this is known as the circulatory system. In the circulatory system, you notice changes are gradual. I mean, it isn't something that you're just all of a sudden going to notice. The heart muscle pumps less effectively. The amount of blood pumped by the heart decreases or is less, and less oxygen is pumped through the body because the heart does not pump as effectively. The liquids in the body are not exchanged through the circulating blood efficiently. Jan, in your work, what do you find is necessary when you're working with the people and the students in caring for and maintaining the elderly with for their circulatory system?
One of the first ideas I think that you have to keep in mind is that the body is a wonderfully accommodating piece of equipment. And the heart and the body has gradually accustomed itself to the inefficiency of the heart. This is another good piece where we need to remember that stress is going to affect this body's ability to deal with this inefficient heart. Therefore, physical activities need to be scheduled according to that client's tolerance. Their clothing needs to be comfortable and unrestricting so their breathing is appropriate. Their fluid level needs to be maintained so they have enough circulating liquid in their body in the form of blood, which will carry the oxygen to the organs and to the brain. Another important piece is that because the body's circulatory system is inefficient, changing position quickly will cause blood pooling sometimes in the lower legs and feet, so that when the person stands up quickly, they might get dizzy and there's a danger of falling. Mm-hmm. So they need to maintain their liquids, change their position slowly. We need to remember that they have established a pattern and an energy level as their body circulatory system's efficiency has changed, and we need to plan their activities within those limits.
Mm-hmm. As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the circulatory system that must be reported to the person in charge at the CBRF are pain and pressure in the chest, arms, or jaw, breathing difficulties, color changes. That means also sometimes on the lips, the hands, the fingernails, the toenails, dizziness, coughing, extreme tiredness, swelling, open areas, especially in the lower legs and feet, and body temperature changes. Along with the circulatory system is the respiratory system. They're kind of buddies because they have a lot to do with the oxygen exchange in the body. And the respiratory system consists of the nose, the voice box, the throat, the windpipe, and the lungs. Fresh air is inhaled and carried to the lungs, and then the waste gases are exhaled from the body. Changes of the respiratory system in normal aging are reduced elasticity in the lungs. You can almost assert it to the similarity of skin, also in the lungs. Amount of air inhaled and exhaled is decreased. Amount of oxygen going into the blood decreases. And you'll notice in the elderly, you'll notice a voice change, and that's many times because the oxygen or the air going across the voice box diminishes. Jan, in caring for and maintaining the aging resident's respiratory system, What is it important to do?
Again, the circulatory system and the respiratory system are very closely tied, so that this physical activity scheduling according to the client's tolerance is very important. That will allow them to oxygenate appropriately, and to the combination of oxygen in their blood will respond to their energy level, and they will then be able to have activities that are not too stressful for the body. They need to change positions slowly again. They need to have safe ability to walk so that they maintain the exercise and the circulation of the oxygen throughout their body. We need to be careful of infections. They need to be careful of someone being around people with upper respiratory infections, because they don't have the ability to fight those infections off, colds and pneumonias, that as they did when they were younger. Avoid strong smelling sprays and lotions and that sort of thing, which will be irritating to them. Maintain adequate moisture in the air. The humidification in the air sometimes needs to be looked at very carefully, so that they can, because these nasal passages are thinning and dry, that mucous membrane is thinning and dry, that the air needs to be humidified. And that, once again, they have to have adequate liquids. And that, by that I mean at least a quart of water a day, in addition to what they get for meals.
I know that when we talked at an earlier time, you had mentioned something about deep breathing exercises. Perhaps, sitting straight, having the elderly person take 2 or 3 deep breaths slow in through their mouth and blowing the air out through their nose, but not too many or too fast, because that can cause dizziness.
Yes, and it's important that they do that on a relatively regular basis, so that they maintain their lungs' ability to expand.
As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the aging resident's respiratory system that must be reported are shortness of breath, color changes, again, of the lips, hands, feet, coughing, and that would be unusual coughing, because as you get to know them, you'll know what's normal with the coughing. Body temperature changes, dizziness, extreme tiredness, coughing up phlegm, whether it be red, yellow, green, or even clear if there is an excessive amount. The nervous system, that's the next system we'll discuss. The nervous system includes the brain, the spinal cord, and the nerves. The nervous system is the communication center, which sends messages to all parts of the body. Special parts of the nervous system maintain the normal day-to-day function of the body. The nervous system is a very delicate system. It's difficult to detect changes in the nervous system because they happen so gradually. They kind of sneak up on you. It is important to know what is normal for that resident, especially when it comes to the nervous system. Jan, what are the changes that we notice in normal aging in the nervous system?
I think one of the major changes that we notice is a slowing down. The reflexes are slower. The recall of information, sometimes the response to conversation or to a surprising event is much slower. That occurs in things that we can notice and see and hear, but it also occurs internally. A fall, for example, the person might not physiologically respond to that fall until several hours later. Slower responses to noise. A change in sleep patterns, takes longer to fall asleep, won't sleep as long in a continuous piece, and doesn't have as much deep sleep, so that the sleep is not always a refreshing thing. Often you'll hear an older person say, I was awake all night, I didn't sleep a wink, and every time you check them, they were sleeping. So that their perception of the sleep sometimes is difficult. Also, there's sleep that occurs through boredom and through when the person gives up, stops trying, I can't keep up, I can't do this, it's much easier to go to sleep. And so sometimes we find them sleeping much longer during the day than is healthy for them, and then they can't sleep at night. Balance and coordination problems are a real deficit as the person ages. And they need to be aware of that, and we need to be aware that they may need some help. It might be useful to use a walker, it might be useful to use a cane, but never should they be rushed, and never should they have to walk too quickly. because it would be difficult for them to maintain their coordination.
So in caring for and maintaining the aging resident's nervous system, it is important to avoid those sudden movements, as you said.
Yes.
And allow enough time for the resident to make decisions, to remember things, to read, to recall information. Do not hurry them. It's very important. Avoid major changes in the daily routine. Redirect or repeat directions or information if that is needed. Allow remembering and talking of the past. And what did we say about remembering and reminiscing that's so important, Jan?
The reminiscing that older people do is a real vital part of their ability to continue living, I believe. They will tell us about times when they were in charge, when they were in control, when their life had some value as they saw it. I think we look at older people and we think they're content the way they are. They don't like not being in control and not being in charge either. And so to tell you about a happy time when a woman was rearing her children and taking care of her house and making favorite foods for people, it's important that we listen with that patiently and interestedly and allow them to say it as many times as they need to say it. Sometimes it's hard not to go along with the story with them word for word because it doesn't change much. But it's very important that they have an active listener and a patient listener when it's time for them to tell those stories.
And when it comes to rest time, sometimes you'll see a person just sitting there daydreaming perhaps, or looking out the window, and maybe they're recalling those times of the past that were so important. It's okay if they don't close their eyes. You know, it's a nice time for them to think about the good days. It's also important to avoid stimulants, such as caffeine, smoking, alcohol, or candy, especially before bedtime. And then again, allow enough time for the person to do their activities of daily living, bathing, combing their hair, to avoid that stress that we have mentioned so often before. As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the nervous system that must be reported to the person in charge of the CBRF are slower reflexes than normal, slower recall of information than normal, slower responses to noises than normal, sleep patterns that are not normal for that resident, increased balance and coordination problems, slurred speech, blurred vision, drooping mouth, loss of use of one side of the body. Very important to report that, and perhaps especially the slurred speech, vision, mouth, and loss of use of one side of the body almost immediately.
One of the things that comes to my mind when you say as you get to know each resident you will know, I think that we need to understand that we all do this in our own families and with people that you do know. If someone in your family comes home from work, you can tell by looking at them if it's been a good day or a bad day or if they don't feel well. And that's the same kind of awareness that a person at a CBRF will have of their clients as you care for them. Sometimes I think that sounds like a terrible message, but you know, I will know them. Well, maybe I won't. Maybe there are 12 people and I don't feel that I would be able to know them. But you will, as you care for them and spend time with them, you'll notice those subtle changes.
Yeah, very good point. Next we will talk about the special part of the nervous system that are the senses. And the senses that we talk about are the eyes or sight, of the nose or smell, the hearing, the ears, the mouth, which includes the throat, and then touching or feeling. The eyes, the changes in the eyes are something that we might notice at a fairly, we consider young age. Jan, could you tell us about some of those changes?
The eyes can become real dry and scratchy, or they can be very teary. I think we all understand about the vision changes about age 40 when reading glasses suddenly appear from nowhere. People who wear glasses at a younger age often are nearsighted, which means they need help reading. They can read, but they need help on the distance. Those eye changes will increase as we age. There's a decreased ability to react to light, which I think is can be a very safety deterrent. Night blindness, often you will find older people who will say, yes, I still drive my car, but I don't drive at night, and it's because of the night blindness. Difficulty with glare or shining surfaces. One thing that I notice in long-term facilities, it's very easy to go into the room and say, it's so crowded, it's so cloudy in here, and the sun is shining, and open all the drapes. And if you watch the older person, they duck to protect their eyes because that's a painful glare. Less likely to pick up color changes. You might find blues and greens. You might find someone with a blue skirt and a black jacket because they can't distinguish between those fairly similar colors. Difficulty with peripheral vision, which is the side vision. It's important to understand that when a person has begun to lose their peripheral vision, that creates a startle impact if you appear all of a sudden into their front vision. So it's good if you're approaching someone from the back and their peripheral vision is gone, and you can kind of hold your hand up there to see what it would be like not to have peripheral vision, that you speak to them so that they have some warning that you're coming. All of a sudden you appear in their line of vision. We've talked about slow reflexes, slow responses. We've put them into a startle mode, so to speak. And difficulty with depth perception. Pouring coffee, putting a cup on a table, the depth perception loses its efficiency, so that's a difficult process for a lot of older clients and can be a danger.
And sometimes you'll see someone reaching for a cup of coffee and they don't seem to ever get there.
Correct. Or reaching behind them to feel the chair before they sit down, and they miss that. Sometimes you can have some unfortunate happenings that way too.
So in caring for and maintaining the elderly residents' eyes or sight, it is important to make sure that they're wearing their glasses if they have them, and to make sure they're clean. And also they should have timely eye checkups by a physician. And maintain a safe environment. Avoid clutter, avoid shiny surfaces, put night lights in hard to see areas, in halls, in bathrooms at night. Clearly mark stairs. If there should be a stairway, mark it with perhaps, if the stairway is beige in color, a red tape or something to define that line. Remove all throw rugs and make sure that thresholds from one area to the other do not cause tripping. And when it comes to commonly used objects, such as perhaps a walker or a cane, it would be better to have them in the reach of the person so they're not perhaps falling even out of a chair to try to reach for it. But then on the other hand, we have to be careful that it's not in the way of other residents.
That's right.
As you get to know each resident, you will come to know what is normal and not normal for them. Changes in the sight or eye that must be reported to the person in charge at the CBRF are excessive dry, itchy eyes, excessive tearing or watering of the eyes, redness, swelling, drainage, or crustiness of the eyes. I'd like to say that sometimes there is slight crustiness even in normal aging when they wake up in the morning, but if there's excessive, or if it's other than normal, speaking about knowing the person, then it needs to be reported. Color changes of the whites of the eyes, complaint of blurred vision or decreased ability to see, and complaint of pain in the eyes. That is not normal. The ears, that sound, hearing, that's perhaps the next outstanding sense that we think of when we think of the senses. And some of the changes in normal aging are a wax buildup, excessive hair in the ears that we already talked about. Visually, the ears become large and floppy. They find that in about 90% of the elderly, there is some degree of hearing loss. If it's just minute, but there is some degree. And there's difficulty in hearing those high-pitched sounds, the D, the K, the P, some of those things. Shouting will not help. Words can sound garbled to the resident, and so therefore when they talk, they will also sound garbled. So in caring and maintaining for the residents' ears, what are some of the things that we should be aware of, Jan?
The ears need to be kept clean, and we need to check for a wax buildup. That doesn't mean poking things in the ears to see if you can get the wax out, but the ears do need to be checked. I think a hearing loss change, a person who is beginning to say, excuse me, pardon me, I didn't hear you, more frequently than they have been, needs to have their ears checked. And if there's a wax buildup, it needs to be removed. You need to speak clearly and slowly in a lower tone of voice. it's an impatient sort of reaction in most of us that if you don't hear me, then I speak louder to you, and what I've done is raise my voice to the level that you already have a hearing loss in. So my speaking more loudly to you is not going to be effective. You need to reduce the background noise. If you want to have a discussion or teach that elderly person something, get them out of the mainstream so that there isn't a lot of background noise. Check that their hearing aids are working and that they're clean and that they're in the right person's ears. I think sometimes you can have hearing aids vanish from room to room. Understand that a hearing aid brings in noises at about the same level, so that if you want to explain something to me and I wear hearing aids, you still maybe need to get me out of the mainstream, out of a living room where the television's going on and people are playing cards, that kind of thing. And repeat information as necessary and with some patience. Because if you aren't willing to do that, the person will just say, okay, okay, and they haven't heard it, but what they have done is they think not displeased you by saying, excuse me, I didn't hear you.
Those are all really good ideas. As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the hearing and ears that must be reported to the person in charge at the CBRF are sudden hearing loss, wax buildup that cannot be removed easily, hearing aids that are not working properly, any drainage from ears, and any crustiness around the ears, ringing in the ears, or dizziness. Next, we'll be talking about the special sense of taste. Changes of the taste and the mouth in aging residents are number of taste buds are decreased, the pain and pressure are not felt as easily in the mouth, and the elderly are more prone to have loose teeth or lose their teeth. The gum lines recede, so there might be pain where the recession has occurred. And then again, because of that pain sensation being a little bit less, they might not have as much pain as we would think. And so there's also a decreased saliva production, dryness of the mouth. In caring and maintaining the person with their mouth or taste, what are some of the ideas, Jan, that we can express?
I think the main thing is to be sure that the dentures or the teeth are clean and appropriate. In other words, the teeth aren't loose if they're natural teeth or decayed, and that the dentures, if they're clean or partial, are in their mouths. They don't do a lot of good sitting in a denture cup. So you need to encourage them to wear their teeth sometimes. Sometimes an older person has lost a lot of weight, and therefore their teeth don't fit as appropriately. And I'm afraid there's a tendency to say, well, he's 85, we're not going to bother getting him new teeth. But some effort does need to be made so that those teeth fit. We have to be careful of seasonings because the taste loss, salty, sugary losses they make the memory of how my food should taste difficult for me to replicate now. In other words, if I remember my mother's chocolate cake tasting this way, no chocolate cake is going to taste the way it used to because my taste sensation is different and my memory probably sees it differently also. So the tendency is for the older person to use more salt, more sugar than they should and is healthy for them. So we need to have either a diversion of taste, use other kinds of spices, try to encourage them to use different kinds of seasonings. Make sure the food's not too hot or too cold. Maintain adequate liquids, but not too many with the meal. You don't want to fill them, have them fill their stomachs with liquids and then not eat the food that they need to do. They need regular dental checkups. Someone needs to check their mouths visually on a regular basis. It doesn't have to be done daily or maybe even weekly. But as you notice changes in eating, not eating so well, not wearing their teeth, you need to take a look and see if there is a physical reason that that's not happening. And to make sure that food preferences are offered occasionally. In a group home, everyone isn't going to have everything they like to eat every day. But the food preferences should be varied, and you should have small, attractive servings. An older person might not have, because they're not so active, they might not have a lot of, as great an appetite as they used to. So it's important that you don't kill their appetite completely by giving them a plate full of food. It should be attractively served and in an amount that would be reasonable for them to eat.
I recall taking care of the elderly that I think it's important to keep track of their teeth. I recall, at night that sometimes you would find the dentures in the bed, or perhaps when they're sitting on the couch. So it's important to know where they are, or perhaps at night make sure they're not in the reach of the person during the night so they don't fumble with them and lose them.
When I said to make sure they wear their teeth, my impulse was to make sure they're wearing their own teeth. Make sure they wear the teeth that were designed for them.
As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the taste and mouth that must be reported to the person in charge at the CBRF are redness, swelling, drainage, or open areas of the mouth or gums, inadequate food or liquid intake, report partials or dentures that do not fit, and report loose or missing teeth and dentures. The next sense that we will discuss is smell, and the smell goes along so much with taste in many ways, as you'll see. Changes of the smell and nose in normal aging are the loss of ability to smell, that increased nose hair that we talked about, and visually our nose enlarges as we get older, and less moisture in the nose, and also thin skin. Skin thins as we get elderly, so there's the potential or the more prone to nosebleeds. In caring for and maintaining the elderly residents' nose or smell, what are some of the hints that you have, Jan?
The hints, I believe, I'm not sure I'd call them hints. We need to keep the nose clean, and the elderly resident needs to be encouraged to do that. Trim the excess hair from the nose if the resident wishes. To maintain normal moisture in the air, because the mucous membrane will dry and there will be bleeding. The elderly person should remember to keep their hands away from their nose and out of their nose. Food should be prepared to increase the aroma gently, I think, because that will impact the taste and will improve nutrition. I think it's important that they understand that they need to be careful about their nose and about if their nose is excessively dry, perhaps their healthcare provider needs to be encouraged to prescribe a salve or an ointment that could help keep that mucous membrane moister.
Mm-hmm. As you get to know each resident again, you will come to know what is normal and not normal for them. Changes of the smell and nose that must be reported to the person in charge at the CBRF are redness, swelling, drainage, including bleeding or open areas of the nose, inadequate food or liquid intake, excessive dryness or cracking in the nose. The last sense that we're going to talk about is touch or feel. There are changes in touch and feel as we grow older, and one of the changes is an impaired ability to feel or touch because we have this sensitivity just decreases somewhat. We have decrease in circulation and a decrease in the number of nerve endings in the skin. In caring for and maintaining the aging resident's touch and feel, it is important to do what things, Jan?
I think it's important to keep them safe, and the reduction of the touch sensation is really a safety impairment. Extremes of temperature, you mentioned the bathtub, doing dishes, it's difficult to feel that the water is too hot for your hands sometimes until your hands are immersed in it and the elderly person has sustained a burn. Many times elderly women, when they're cooking, won't use hot pads for pan handles, and they will pick up the pan from the stove and not realize that it wouldn't feel hot to them. About halfway across the kitchen, all of a sudden it's hot. So you have a burn on the hand and maybe drop the pan, which means you have a hot liquid or hot food on the person, on the floor, which then provides another environmental danger. So that the extremes of temperature, the heat, sunburn, being outside without protection is also something they're not going to feel, that it's terribly warm and that their skin can be burned. Also cold, they will not sense cold as well. The touch and the feel will not give them an awareness of how warm or how cold they are. Make sure their shoes fit properly, because they may not feel a tack or a loose thread or a stone in their shoe even. Make sure that the socks fit appropriately. I think we think about holes in socks, but we don't think about holes in hose. I remember a woman who came into the hospital with a gangrenous toe that had pushed through the nylon, and she hadn't felt it until someone else saw it, and she actually had a gangrenous toe because her toe had been through that hole in the stocking for a period of time. Avoid tight clothing, use good skin care to maintain the integrity of the skin, because they really by touch can't feel that. They aren't going to feel a blister or corn on their foot, for example. Once again, the shoes need to fit. We need to look at their feet. We need to look at their hands to make sure that there aren't hangnails, blisters, any of those things.
When it comes to temperature in the room, sometimes as a caregiver you're really warm because you've been working, so hard, but the resident feels cool. Get a sweater for them. Go to their closet and get them a sweater, or perhaps there's some kind of a throw around in the room that you could give them to make them comfortable. As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the touch and feel that must be reported to the person in charge at the CBRF are redness, swelling, drainage, discoloration, or open areas, safety hazards, and report too hot or too cold temperatures of objects in the environment. The next system that we'll be talking about is the digestive system. The digestive system consists of the mouth, the esophagus, the stomach, and the intestines. It also consists of the glands that produce the enzymes that break down the food and liquids to nourish the body. It also rids the body of unusable foods and liquids. What are some of the changes of the digestive system in normal aging, Jan?
One of the changes that occurs that affects the ability to swallow and the ability to keep the skin in the mouth healthy, or the mucous membrane inside the mouth and throat, is a decrease in saliva production, so that the mouth, the mucous membrane will be drier. It's important then that we provide fluid, enough fluid, which will help take care of that. There's a decrease in the ability to chew and to swallow, and a weakened gag reflex, all of which are safety hazards for an individual. We need to give them time to eat. We need to be aware of the people who do have problems chewing, problems swallowing, and have that weakened gag reflex. The food moves through the system more slowly. Therefore, you can have gas or bloating, constipation, which is a very much talked about difficulty with older people, decreased appetite, and heartburn. Fluids are not absorbed as well to provide nourishment for the body. Part of that is because an older person often will not take in enough fluids, and then the fluids are needed elsewhere. So the elimination of the waste products is difficult because there isn't enough fluid to help that move through the colon. And rectal and anal muscles become weaker, which makes independence in eliminating waste from the body sometimes a problem.
Mm-hmm. So in caring for and maintaining the resident with in the digestive system, it is important to provide adequate food, fiber, fruits is always good, and then liquids other than the ones eaten at mealtime, water, whatever. Serve food cut in small pieces, maybe ground or pureed if that's what's needed, and as you said, allow them time to eat. We have the tendency to think that if someone else is done, or if 10 people are done, the 11th person is done also. Sometimes it just takes that person a little longer to eat. Make sure dentures are in place. Encourage regular physical activity. That also helps the bowels to move. Maintain records of bowel movements. Most places have a record-keeping method. Use incontinent products if needed, and keep the incontinent residents clean. Keep them all clean, but especially be attentive to those people that are incontinent. And provide a raised toilet seat or grab bars so the person is safe. You grab bars near the toilet or in the shower or bath area. As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the digestive system that must be reported to the person in charge at the CBRF are changes in appetite, changes in intake of liquids, changes in ability to chew or swallow, changes in the number of bowel movements, changes in color, odor, firmness, and or size of bowel movements, complaints of nausea and or vomiting, redness, swelling, drainage, or open areas of the rectal area. The next system we will discuss is the urinary system. And the urinary system consists of the kidney, the bladder, the ureters, those are the tubes that go between the kidney and the bladder, and the urethra, which is the opening from the bladder to the outside. The urinary system removes the liquid wastes from the body, and that liquid waste is, as we said, urine. Changes of the urinary system in normal aging are the bladder loses some of its elasticity. That's one that we might notice outwardly because someone will be dribbling, so to speak. Decreased bladder size and decreased kidney size. So sometimes people have to go oftener than they did when they were younger. So in caring for and maintaining residents, the urinary system, what needs to be done, Jan?
I think one of the things that I like to remember is that as a parent with a child, the rigors of potty training, but to look at that from the standpoint of the child, that's probably the first independent function that they really could control and control people around them by it. That was my first, we certainly validate independence and growth by being potty trained, by being able to be independent in your toileting. Now we have people who require some assistance in toileting, so we need to remember that it takes some sensitivity and they need to be helped preserving their dignity and not embarrassing them in any way when we give this care. There needs to be adequate liquid, and sometimes that doesn't make sense when Mrs. Jones is dribbling every hour and then you're telling me I should give her more water to drink. You know, why would I do that? But the bladder is not efficient until it has at least that quart of water we talked about in one of the other discussions, in addition to meals every day. It'll take the body about 2 weeks to become accustomed to that, so Mrs. Jones isn't in the bathroom all day long. But you need some help convincing her that that's something she needs to do, so then her ability to prolong the time in between her trips to the bathroom will be a reasonable expectation. The bladder needs to be emptied, and sitting on the toilet or on a commode is the best way to do that because gravity helps empty the bladder. A bedpan doesn't do that as efficiently. Use incontinent products when necessary, and please use them discreetly, and provide good skin care for the elderly person. They need to be safe. They need to have perhaps a raised toilet seat, but at least grab bars so that they can be safe while they are toileting. Independent toileting is best, and sometimes that can still be accomplished, but you need some reminding that I believe it's time to go, and let me know when it's time to help you with your clothing. I'll be glad to do that. Mm-hmm.
If you notice wetness, for instance, take them aside rather than embarrassing them in front of others.
Oh, yes.
Calling them, well, would you come here? And then taking care of the situation.
Yes, yes.
As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the urinary system that must be reported to the person in charge at the CBRF are decreased or increased urine output, report changes in urine color, odor, clearness. Report residents' complaint of urinary frequency, urinary burning, urinary dribbling, urinary incontinence, inability to urinate, difficulty urinating. Redness, swelling, itching, odors, drainage, or open areas of the genitals are important to report. The last system that we're going to talk about is the reproductive system. The reproductive system in women consists of the ovaries, fallopian tubes, uterus, and vagina. The reproductive system in men consists of the testicle, penis, and the prostate gland. The reproductive system provides individuals with the ability to reproduce and enjoy the act of intercourse. Could you tell us about the changes of the reproductive system in women, Jan?
The most obvious change in the reproductive system in women is the absence of a monthly period or menopause, the much joked about process that has some symptoms of its own that will need some attention. But there's a decrease in the size of the genital area, there's a decrease in the lubrication of the vagina, the inability to become pregnant, a decrease in the amount of pubic hair, and a slower sexual response. That's pretty much the clinical picture of the changes in the reproductive system in women.
And the changes in the man in the reproductive system are like decrease in the size of the penis, increase in the size of the testicle, and then increase in the size of the prostate gland. Almost 3/4 of the population of men over 65 have this increase in the size of the prostate gland. And because it involves the urethra, the opening to the outside of the body, it sometimes closes it off a little bit. There might be some dribbling or difficulty for the men to get a flow started when they want to urinate. Reduced sperm. And men are able to reproduce indefinitely, but there is a reduced number of sperm, and a slower sexual response. In caring for and maintaining the aging resident's reproductive system, Jan, what is it important to do?
I think the main important thing that we need to do is to maintain genital cleanliness or allow or help the resident to do that for themselves. We also need to provide privacy for sexual activity or release. That's difficult to do in a CBRF or a long-term facility, but that's a consideration that needs to be maintained with the residents' preferences and with the general rules of the home. That needs to be done with some sensitivity by the caregiver.
Yes. As you get to know each resident, you will come to know what is normal and not normal for them. Changes of the reproductive system that must be reported to the person in charge at the CBRF are redness, swelling, drainage, odor or open areas of the genital areas, vaginal itching in females, and inability or difficulty urinating, especially in men due to that prostate gland enlargement, increased